The empowerment component is so big. It's huge. And patients are not empowered by their doctors. Most of the time, they're disempowered, right? They're told there's nothing you did to contribute to your situation. There's nothing you can do to help yourself except for show up for treatment. And what you and I know to be true is that there's so many things a patient can do to increase their odds of survival.
Exactly.
To decrease their risk of ever getting cancer, to decrease their risk of a recurrence if they're in remission. There's so many things you can do, and it not in an overwhelming way, but it really just boils down to making very simple shifts to your daily routine, from what you're eating to the way you're thinking to maybe where you're working or your living situation, right? There's some big changes and small changes, to exercising, to choosing to think positively and instead of negatively, to choosing to forgive people who've hurt you. These are all things that that any person can do, right? That any person can do. And most of them don't cost anything, right? You know, granted, specialized treatments cost money and supplements cost money and special therapies cost money, but forgiveness and eating healthier and exercise really don't cost you anything. You know, it's like, and faith is free, fasting is free, you know, so there's so many powerful therapies. And that's the thing. It's like the most powerful therapies in my mind are the ones that cost almost nothing and are the ones that most people don't want to do, right? And that's change their diet, and that's forgive and exercise and maybe do some fasting. Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.